I'm Mike, and I have type 1 diabetes. Diabetes can't be cured, but it can be treated and managed. I wear an insulin pump, and I monitor my blood glucose levels. When my blood glucose levels are too high, I'm at risk for complications that I don't want, including blindness and heart attack. When they're too low, I feel dizzy and weak. I prick my finger to measure my blood glucose level 4 to 6 times a day. I wear a glucose sensor that gives a reading every 5 minutes.
Hi Mike, how are you doing?
Oh, not too bad.
Good. I have over 600 patients like Mike with type 1 diabetes on insulin pumps. And although I only see them in the office 3 or 4 times a year, between office visits I'm asking them to send me their pump and glucose monitoring data that I try to adjust their blood sugars between visits. You can imagine the amount of information that I get, and it results in data overload. And so I asked the artificial intelligence engineers to help us develop a solution for this problem.
In the SmartHealth lab, we're using AI approaches, including case-based reasoning, classification algorithms, and time series prediction, to help patients like Mike and physicians like Dr. Schwartz. Our 4-diabetes support system, or 4DSS, uses case-based reasoning to solve blood glucose control problems based on past experience.
The 4DSS works like this. The patient sends data from their pump and sensor. They also send live events like food and exercise. The system detects problems like when the patient goes low after exercise. To solve a problem, the 4DSS finds the closest case to its case base. Each case contains a problem, a therapy adjustment, and a clinical outcome. The therapy adjustment from the closest case is adapted and provided to the doctor as decision support.
Excessive glycemic variability is a term we use to characterize excursions of blood sugars in diabetics that are outside the normal range that we see in non-diabetics. And we know that the magnitude and frequency of these excursions is associated with increased risk of complication. Physicians know what it looks like when they see it, but we wanted a way to accurately quantitate that with machine learning.
We asked physicians to classify hundreds of blood glucose plots as excessively variable or not. Then we trained machine learning models to classify the plots like the doctors. To do this, we smoothed the plots and extracted descriptive features like standard deviation and area under the curve. Next, we input the features to machine learning models and tested to see how closely they agreed with the doctors. Our best model so far has an accuracy of 93.8%.
Beyond finding problems and fixing them, we want to be able to predict when a problem will occur. Prediction is a more difficult task, however the benefit is greater. For example, patients whose blood glucose goes low while they sleep are at risk of not waking up. If we knew they would go low in advance, we could wake them up in time to prevent the problem. We use time series forecasting models to add in blood glucose prediction.
We take blood glucose and life event data. We smooth the data and extract predictive features like food and exercise. We feed these features into our model. The model makes predictions at 30 and 60 minutes. This will be plenty of time to alert patients who might be at risk, assuming our predictions were accurate. We are making progress, but there is still more work to be done.
Exercise. Decrease your insulin flow so you don't go low.
Thanks, AI.